Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. Today is February the 16th, and we'll do our regular Facebook Live. It's a chance for you to get questions answered. We've already collected a bunch of questions for people, put them on the Facebook questions at douglaspublichealthnetwork.org. So if you do that in the future, you're almost guaranteed of getting your question answered. You can also put it in the chat section. We have one of our incredible staff members. You know, they've been doing this for a year now, twice a week, staying late or whatever to go ahead and get these done. What they do is they go through the chat section. They then paraphrase your question, send it to me by a special computer link. So there are people say, oh, you didn't answer my question. Well, I don't actually see the questions until later that night, so if you don't. Anyway, so we'll start as we always do from the world view and then move down to the Douglas County view and tell you what's going on. So in the world view, the pandemic is slowing. That's an incredibly good thing. We're seeing a slow number of cases really throughout the world. There's still a few hotspots in Europe, especially in Austria, Sweden, Spain, and Portugal. But UK is quieting down, South Africa is quieting down, and Israel, which had been very high, is also starting to quiet down. That's great. The US, which had a very high rate of disease, remember we had days when we had over 300,000. We're now down to 100,000, a tremendously wonderful change in the country. And when you look in the country, there are a couple of hotspots. South Carolina, an unusual hotspot. Texas has been a hotspot, places in California. And so those are the hotspots there. Oregon has had a relatively low number of cases this week, although with all the terrible weather they've had since last Friday and Thursday they started buckling up, the numbers in the state are not quite believable, and they may be actually higher than have been reported. Unfortunately, the story is about Douglas County. So for 10 months now, I've said, you know, Oregon is one of the best performing states. It still is. And Douglas County is one of the best performing counties in Oregon. Oregon continues to be a good performing state, but now Douglas County has had its worst week ever. So most people had their worst week ever, either in the springtime or in between November and December. This was our worst week ever. So we've had well over 200 cases in the last 10 days. And they just keep coming. We had 39 again today, and looking at the numbers this afternoon, we're going to have a lot again tomorrow. So it's very, very, very worrisome as to why we're having so many cases. And so people have said, you know, what's going on here? You guys have been one of the lowest counties, doing a really good job. What's going on here? And I think there are several explanations. One is there's a large outbreak in a nursing home, and maybe in two others now. And that large outbreak accounted for many cases, over 50 cases associated with that one nursing home. But even taking that nursing home out, even get rid of all of those cases, we still have far too many cases over the last 2 weeks. That nursing home outbreak is both among staff and among residents. What we did find is that some of the staff were vaccinated, some of the staff that weren't. The vaccine was incredibly effective, overall about 90% effective in the entire group. And the group, at best, had been only vaccinated for a month. So the vaccine actually gets better with time. So these people were at the very beginning. And still, we saw at least 80% for the patients and up to 100% for the staff. So we know the vaccine works, but it had a very high attack rate. In fact, we think every patient who was not vaccinated got the disease. That is absolutely stunning. And there are two other outbreaks that are starting in nursing homes. So nursing home outbreaks are going to occur. We've had several over the time. They've had high attack rates, and they really are problematic. In the past, we could do as best we could do to separate people and try and let it go out. But now what we have to recognize is there is a vaccine, and the vaccine seems to be very effective, both nursing home patients and especially among nursing home staff. And so we really have to encourage people working in nursing homes to get vaccinated. The second thing we've seen is the schools are open. So there's this map you can look at in Oregon that looks at the open districts. And last week, most of the open districts in the entire state were in Douglas County because we had a relatively low rate of disease. And so many, not all, but many of our schools have opened. And when our schools open, we see cases at schools. We do not think we're seeing any transmission in class. So we do not think that Johnny in his third grade class is giving it to Sally in the third grade class. These are such old names. Giving it in the third grade class. But what we do see is that when schools are back in session, that people do other kinds of things that are associated with schools. So the third graders are back. The third grader has an 8-year birthday party, invites all the friends. A very logical and typical thing to do. And then they come to the birthday party. And we saw a big outbreak associated with the birthday party. They do sleepovers. We've seen a big outbreak associated with the sleepovers. We've seen outbreaks associated with sports teams. Well, I don't think the sports teams necessarily got it on the playing field as they're out there running around, but anybody who did sports knows that before sports, you drive and pick up your friend to go to practice and drive together in the car. Then that after practice, you're hungry as can be and you stop at McDonald's and eat a bunch of food. And so we don't think it's actually the athletics or the competition. We think it's the things that happen before and after that. And that's an enormous concern because that's part of what sports is about. So sports is not just about what happens on the field, it's the bonding that you have with your teammates and with others. And so this is where we're seeing a lot of cases. So we have 23 school outbreaks. 23 school outbreaks. And every one of those school outbreaks has dozens or scores of contacts. And so it's just overwhelming the number of new contacts we've gotten associated with that. And I'm not blaming anyone. 8-year-old birthday parties are important. When you get to my age, I don't need any more birthday parties. But at 8, a birthday party is an incredibly important thing. When you're on a sports team, bonding with your teammates is a very important thing. So there's no blame going on here. But I think it's an explanation of what's going on. The third thing we're seeing a lot of workplace outbreaks. So we have these workplace outbreaks, none of which are enormous, but 10 and 12 here, 10 and 12 there, and then the next thing you know, you have a lot of cases. And these outbreaks, again, do not seem to occur at the workstations. They seem to occur because these guys, admittedly, hang out before work, they have lunch together, they hang out after work, they go to the bars together, and they do the kind of things that people do when they kind of let down their guards. So, we've been in the high range now for 8 weeks. I mean, the only big county that's been in that low range for 8 weeks. And I think we're seeing there's a laxity in some of the behaviors and a sense that, hey, we can kind of return to normal. But it's very clear that when we return to normal and let go of some of those things, that the diseases will come roaring back. And you say, well, these are cases, most are among kids or whatever. But then what happens is it spreads to the seniors. And so, for example, one of the nursing home outbreaks is tied to a sleepover and a workplace outbreak. And so you get all those things together, and this is how it spreads, right? So a kid in school has it, they're not very sick, they give it to another kid at a sleepover, who then gives it to their parents, and the parent gives it to the other parent, and that parent then works in a nursing home, and then it gets to the nursing home. So I think what's happening is we let up a bit, and when we let up a bit, it really, really, really started to spread. And right now, we are in a stage where we have so many cases over the last 10 days that it's extremely likely we're going to be in the extreme range come when they do the data on Monday, and then that will reflect closing of business on Friday. Now, again, this is nothing that I have any control over. I don't set this. I don't say what we should do. This is a state thing based on a metric that the state controls. So it's not like I can change the number of cases or when we count them, whatever. The state does this in their system and do it. It looks like it's pretty likely we'll go back to that extreme range. So, got a lot of other interesting things here, but it's time to take your questions. So, due to the recent explosion in numbers, do you know if this is a direct connection to either new variants or the school opening? So the variants are mutations of the virus that may be more contagious or perhaps more deadly. We have sent out our samples for genomic analysis to look for variants. We do not have any of them back yet, so I don't know. There are a couple of worrisome signs. So, for example, the attack rate, that is, if one person in the family gets it, how many more people in the family get it? In the past, if a family got it, you'd expect about half the family to come down with it and the other half of the family not, which is weird. But in the last 2 weeks, we've seen a bunch of cases where everybody in the family, 7 out of 7, get it. And again, in this nursing home, every non-vaccinated patient got it. That is a worry that there might be a variant there, but we'll know because we did send them all away. Is it related to school opening? I mean, absolutely. I think school openings clearly reflect a relaxation of rules. So I talk to kids every day that I'm in the clinic. So on Tuesdays and Wednesdays, I'm in the clinic and I talk to teens and ask them what they're doing. And when they're at home, they typically were at home. They didn't see friends, they stayed at home, and they didn't have a lot of exposure. Now that they're back in school, they are seeing people at school, but then they're staying over at friends' houses, they're going to sleepovers, they're going to a play date after school, and there's those extra exposures that do it. So I don't think it's actually school opening itself, because again, it's really hard to show that we have any transmission at school, but it's all those things before school and after school that we have a really, really, really hard time with. So Marcia says, I qualified by my age yesterday and called my primary care provider and was given an appointment for March 31st. Ooh, is that the soonest I can get in? Well, the vaccine story is not a pretty one. So they tell us about our vaccine allocation on the Thursday or Friday before the week. So starting on February the 8th, those 80 years old and above were eligible. We got our allocation on the Thursday or Friday before that, and we had 700 doses for people 80 and above. There are people who question that and do all kinds of things. I can actually show you the allocation sheet from the state that said there were 700 doses for people 80 and above. There are 7,200 people 80 and above in the county, so clearly not nearly enough vaccine. We then last Friday night got our allocation for this week, and it was going to be a little bit more, and that was a good thing. The problem is, although it was allocated last Friday night, it's stuck somewhere in Kentucky or Tennessee. And so we haven't seen any vaccines this week. And we added another 5,500 people who were 75 and above. So now we have over 12,000 people 75 and above, and we've received a total of 700 doses. Clearly, that's not going to work. Now, the good news is, right before I was here, we're working on all kinds of ways to get more vaccine and whatever. I think it's going to really open up in the next few weeks, and that's a good thing. But right now, that 74 and you're out that long is absolutely horrible, but probably not anything we can do, at least in the short run. Now, what we're hoping is that as we get more vaccine, we can tell your provider, instead of the 4 vials of vaccine they were getting before, we can now give you 10 vials, in which case they can move people forward. But, what we've asked people to do is to not schedule more than we actually see the vaccine in our hand, because it's bad to be scheduled out to March 31st. It would be terrible to be scheduled for February 10th, and they call and say, oops, we didn't get any yet. February 15th, oops, we didn't get any yet. And I will tell you, this pattern is played out across the country, because the pattern of not enough vaccine for the people who want it is exactly where we're at now. But, we're doing everything. We got these special super duper freezers. We have now 3 of them in the county, so we can take the special vaccine. We tell people if they have any extra doses, we can do it. So that I'm trying as hard as we can to get the vaccine that we need. Now, one of the things that people will notice is that when you look at the OHA website, we have one of the lower vaccine rates in the county, in the state. So our county, Douglas County, has one of the lower vaccination rates in the state. And I think there are 3 reasons for that. The first reason is that the VA vaccines get reported directly back to the CDC, but not back to Oregon. So the 2,000 or so vaccines that they've done in the VA, which are Oregon, Douglas County residents, do not get counted in the number. The second is we have gotten less vaccine than other areas. And as it's been explained to me, and I think this is correct, is that in the beginning, there was a real preference for the large hospital system events, Asante, Peace Health, St. Charles, Salem Health, OHSU, and Kaiser, to get a lot of vaccine because they could move a lot of vaccine quickly. Well, if you've noticed, none of those are in Douglas County, and so we got passed over with that. The third is there's an unusual thing happening with the state computer system, and we're still trying to track that down. I should know more about that on Friday. So Tammy says, my daughter tested positive. All right. And it took several days to be contacted. That's a problem. And this happens sometimes because the provider who does the test may call us right away, or they may not. The other thing that frequently happens is you think you're a contact, but the person who was the case didn't list you as a contact. So every day I get a call from someone. Well, I was a contact of Joe something and at my work and nobody called me. And I look back then on Joe's interview and we say, did you have any contacts at work? And they said, no contacts at work. Well, if Joe says he has no contacts at work, we don't do a polygraph or do a police investigation to find his contacts. Or if he says he has no contacts at work, we'll say, really? And then he says, yeah, really. Then we wouldn't contact you. So that happens here. I do not know why it happened. So my provider said I didn't need to quarantine because I had a negative test. Very complicated. Depending upon when you were exposed, that could or could not be true. So Tammy, what I'd ask you to do is to call the hotline tomorrow and talk with one of the case investigators and figure out exactly what goes on. Because you say that doesn't seem right to you and it doesn't seem right to me either. But again, we need to figure it out. All kinds of funny information we get, so we'll look at that. So I received a call, Janet says, I received a call from somebody saying they were from the CDC worrying about the vaccine. Does the CDC do that? No. So there's a lot of scamming going on here that we're seeing, either people being told not to get the vaccine or people being directed to a website for a vaccine. Nobody's going to be calling you to do that. Now, your doctor may call and say, hey, we got a vaccine for you, but it should always be somebody you know. We think this is going to be a rife time for scammers. What I've heard in other areas is they say for $100 we'll get you signed up. You say that seems like a good deal, and they'll just take your $100, so be very, very careful. So Earl says, I need my second dose. I got my first one in Hawaii. Help, please. Ooh. Well, that's a problem because you're generally supposed to get the second dose where you got the first. So what happens is that the second dose gets paired with the first dose. So if you get the first dose, say in Douglas County on March the 1st, on March the 28th, another dose will arrive to give you your second dose. And so the ones that you got on the first would be called the prime dose, and the one that you get back there is called the boost dose. And every prime dose is associated with a boost dose. The problem is that if you got your prime dose in Hawaii, your boost dose is waiting for you in Hawaii. And since you did not get your prime dose here, there's no boost dose waiting for you here. Now, if traffic were all the same and things were all the same, this would even out. But it's clearly not evening out, right? So, for example, Salem had this drive-through thing where they did anybody, and a lot of people got their first dose there. Well, all the second doses for those people who got the first dose are going to Salem. Since we didn't have that crazy drive-through thing down here, this is a one-way street. So we would then have to use one of our prime doses to vaccinate those people from Salem. And the state has said, don't do that. If they drove up to Salem to get their first dose, they should drive up to Salem to get their second. This is a little different. It's not so easy to drive to Hawaii, and we'll try and come up with a solution. But in general, the story is you're supposed to get the second dose where you got the first. So 74-year-old says, how do I get on the list for the vaccine? So 74-year-olds become eligible next Monday. And next Monday, then I would have you work with your provider. So most of the providers in town have vaccine, and they'll get you signed up. If you don't have a provider, you can sign up with one of the pharmacies. And now we're dealing with the 3 Bi-Mart pharmacies, Gordon's Drugs, Albertson, the 2 Albertson stores, and Costco all have vaccine. So if you don't have a provider, you can call one of them and get signed up. But again, the amount of vaccine is very small, so it may be a while to get there. I will tell you, this happens everywhere. My mom is back in Virginia, and she signed up, and she's 91. She still doesn't have an appointment yet, so she has no way to know. So Veronica says, when does the 2 weeks start over? So in Oregon, the 2 weeks starts on Sunday at 12:01 a.m. So, I mean, unless something extraordinary happens, it looks like we'll be out of the high range this week, but I don't know. So Janet says, will non-tribal gambling places open in the extreme category? So no. So basically in the extreme category, indoor activities like gambling areas and bars and restaurants are closed for indoor activity. But again, I'm not sure what a non-tribal gambling place is. So Chad says, after the second dose, how long do you have immunity? I've heard 3 months. So relatively new vaccines that were tested in October, November. It looks like, so they were tested in October, November, so you had December, January, February. We're only midway through February. It looks like you have good protection that long. It's hard to say how long the protection is going to last, right? Because nobody's had the vaccine for that long. But it looks like this is going to be good, long-lasting immunity, much more than 3 months. When you look at the curves, they're still really separating, suggesting that it's going to last at least 3 months. And as we go out further and further and further on these people with Pfizer and Moderna, we'll see. So what they have is they have a list of the people who were in the vaccine group, and they look at the number of cases those people have had, and that number is really flat, suggesting that the immunity lasts at least 3 months, but you'll know as you go a bit further. So Denise says, is the 2-week window a rolling 2-week or a set 2-week? It's a set 2 weeks. So it's a set 2 weeks. In between, there's a warning phase, but it's a set 2 weeks. Okay, so Veronica says, let's say you have someone come over that's coughing, and you're around them all day. Is it too late? Have you already been exposed, or is it the more time you're together? So the story about this virus, which is really weird, we see some people don't spread it to anybody else, and then others who spread it to dozens of people. We do think the longer you're together, the more risky that you have. Sharing a room with someone is clearly a risk. Sharing a meal with somebody is clearly a risk. But if it's hard to know if you're already exposed, but if you know that person is now positive, you should just stay away from them. So we have 2 incredibly good studies and then 1 natural experiment. So if we have time, we'll talk about the NFL, we'll talk about Abundance 360, and the United States Marines. So Connie says, after receiving both doses, can we be around other vaccinated people without masks? How careful do we need to be? Well, so the vaccine is incredibly good at preventing symptomatic disease. It's pretty good against preventing asymptomatic disease. So what they did was, in the people who got, one of them, the Pfizer and Moderna, what happened, before they gave them the second dose, they swabbed their nose to see if they were positive by PCR. And there were some in the vaccine group and some in the placebo group that had it. Clearly gave some protection against asymptomatic infection, but not nearly as much as it gave against symptomatic infection, and not nearly as much as it gave against severe disease. So some vaccines prevent mild infection but don't do much for severe disease. This one is backward. This one gives you great protection against severe disease. In fact, the amount of severe disease in people who are vaccinated is vanishingly small. Prevents against symptomatic disease and does an okay job against preventing against asymptomatic disease. So yes, you could have asymptomatic disease. So we need to wear a mask until the disease is really down to ground. Judy says again, how do you get a vaccine in Reedsport? Again, Lower Umpqua Hospital is doing it. They're doing an event today where they're giving out vaccine. They're working on a call center. I do not know where they're on that yet, but they're working on a call center to get that. The problem they have, like everybody else, is they have almost no vaccine. So they drive over once a week to get 50 doses of vaccine. I mean, it fits in one hand, but that's all we can give them is 50 doses of vaccine because we're getting so little. So Leanne says, can you get reinfected with the new variant? Well, this is very interesting, and this is what keeps epidemiologists up at night. Now, if I could guarantee you there wasn't going to be a new variant that was going to escape the vaccine, or that if you'd had previous disease you wouldn't get it, we would be pretty much done with this. The problem is there's studies in both South Africa and Brazil that people who clearly had the disease before got sick again with the new variant. That's really worrisome, right? That says your body made an immune response to the first virus, and now the virus comes back again in another form and it doesn't recognize it. If that's the case, that's very, very, very worrisome. And so I do not know if you can get infected with a new variant. The data from South Africa and the data from Brazil suggests you can. So if I'm fully vaccinated and I'm exposed, can I bring it home? yeah, we don't think we think the vaccine is very good against serious disease. We think it's really good against symptomatic disease, but we don't know about asymptomatic disease. And this is a perfect time to talk about the Marines. So I have a great love for the Marines. My son and daughter-in-law both served in the Marines. And I was in the Navy for a long time, and one of my duty stations was in Okinawa, Japan, which is mostly a Marine base with a few Navy guys to go ahead and provide medical care. And I developed an incredible respect for the Marines. You know, these are young guys who travel all over the world, live in generally very harsh conditions, and train like freaking crazy. I mean, these guys are amazing what they do. So when I was in the Navy, one of my jobs was to teach combat casualty care, which is what happens when you get shot. And so I would teach that, and they would take us out to the boonies in Okinawa, and their ability, and so I got to go on some of their recon missions and whatever. Their ability to do these things is just incredible. So the Marines are great. So the Marines were wanting to do boot camp, and they realized that if they just did boot camp, typically they'd have a lot of disease spread. So what they did was they asked the Marine recruits to quarantine before they got there, and then when they got there, they quarantined them there. They tested them all the time to see what was happening, and what they found was that even though they tested them when they arrived, a number of people were brewing the disease and got it later. They then tested everybody along the way and found that if you shared a room with somebody, pretty likely to get it. If you shared a bathroom with someone, pretty likely to get it. If you shared meals with somebody, you're pretty likely to get it. If you shared a hallway with someone, and they were very careful not to go out in the hallways, you were somewhat likely to spread. But if you didn't share any of those things, didn't share a room, didn't share a meal, didn't share a hallway, you didn't pass it to other hallways. So this virus was not something magic that spread around, but was something that did spread in those things, living in the same room, eating in the same place, and walking down the same hallway. So that's it. So, you know, that really shows that if you can avoid those things, it makes a big difference. Now, why are meals so important? Well, meals are so important because you pretty much need to eat. So you take down your mask, and then there is spread that way. Turned out they did not think there was much spread outdoors. So, for example, people lived on different hallways that exercised together didn't seem to spread it to each other, but meals, living together, and sharing the same hallway. So, you're fully vaccinated. Can you bring it home? Probably you could. And so, while we think that this vaccine is pretty good against preventing symptomatic disease, probably less good against preventing asymptomatic disease, and then you might be able to spread it to others. So Jeffrey said, is there an updated list of Outbreaks work schools? Yeah, that OHA provides those. They do them every Wednesday, and we let them take care of it. We look at the updated list twice a day, actually. So in the morning and the afternoon, I get an updated outbreak list. So Denise says, have outbreaks happened on school buses or at school bus stops? So we do get school cohorts for buses. So who's actually on the bus and where they sit. We do not think they've happened on the buses, but you know, who knows what happens at bus stops, right? So as you drive in the morning and see the bus stops, the kids are there, may or not be wearing masks, may or may not be gathering, may or may not doing the flirting kind of things that kids do at bus stops. So we do not think so. So typically when we've seen 2 cases in schools, there is a tie outside of class. So, for example, we saw one place where there were 3 kids who were connected, and they were connected by a sports team, but actually probably not from the sport, but from the time before and after the sport where teammates gather. So Leanne says, somebody with pre-existing conditions, when will they be eligible? Oregon has still not come up with a strategy for pre-existing conditions. And so that brings me to another thing that I looked at. And so New York, for example, is doing a pre-existing condition thing, which is a total mess. So you have to get a note from your doctor about your pre-existing condition. I can't quite imagine that. So we looked this week to see what were the greatest predictor of bad disease. Because really what we're looking to do is to not have people die, thank goodness, and not have people be sick enough that they need to be in the hospital. So if you take the level of hospitalizations or death, which are the two big factors, not just disease, right? Because I think a 23-year-old with disease is a problem for spreading it, but a 23-year-old with disease is not going to clog up the hospital system and is very, very, very unlikely to die. So what are the risk factors? Far and away. So you pick the lowest risk person would be a 30-year-old white woman. So the chance that a 30-year-old white woman would either be hospitalized or die is very small. If they got the disease even, it would be less than 1 in 100, maybe even less than 1 in 1,000, that a 30-year-old white woman with the disease would get that. So what other things? Well, age is clearly the most potent predictor. So she gets to be 50, and then 70, and then 90, her risk goes up exponentially. So your risk of dying from this disease when you're 90 is over 10%. Over 10%, that's a lot. And so age, clearly a risk factor. The second is sex. Men just don't do as well as women with this disease, maybe because we're slobs, but I think men tend to have other issues that tend to cause issues, but just the male sex seems to be a potent risk factor. Race is clearly a risk factor. So people of color and Hispanics clearly have a higher risk, perhaps because they tend to be in occupations where you can't work from home, maybe because they have underlying health conditions, and maybe because they get crappier care. I mean, while we say no, everybody gets good care, it's really clearly not the case, right? So when Rudy Giuliani got sick, he checked himself in to the hospital. When Chris Christie got sick, he checked himself in to the hospital for a week and got top-notch care. I don't think if you live in the Bronx, you can just check yourself in to the Bronx hospital and get it done. So there's clearly some race and ethnicity issues. So age, clearly potent predictor. Male sex, clearly a potent predictor. Race and ethnicity, clearly a potent predictor. And then blood type, people have been worried about that. So O blood type is a little bit protective, A and B a little bit worse, but about 10 or 15%. Age is 100 times. So you're 100 times more likely to die at 90 than you are at 30. Male is about 2 times, race is about 3 times. Underlying conditions range anywhere from 1 to 2.5 times. Fortunately, the most potent predictors of underlying condition is smoking and obesity, 2 things that really have a negative view. So if you said, okay, we're going to go ahead and put fat smokers in front to get vaccine because they tend to be at high risk, that's going to be a little hard. Diabetes, cancer, heart disease are all potent risk factors. So there's a risk factor prediction tool about what your risk of hospitalization and death will be, and you can find it on the web and put the numbers in, and you can see that these are all potent predictors for who's going to do badly. So again, you're under 60 but have underlying conditions. How are we going to Oregon handle that? I do not know. So Amy says, have you seen any cases where somebody with 1 dose was exposed and didn't get the virus? Yes. So in the nursing home, we have a number of people who got 1 dose. Other people got the disease and they were protected. So it seems that 1 dose was between 60 and 80% preventive, which we thought, and that 2 doses was between 80 and 100% protective. So yes. So 1 dose is protected. Actually, when you look at the curve, really about 14 days after your first dose of either the Pfizer or the Moderna, you certainly do have some protection. All right. Is there any testing sites that are open after 7 p.m.? There is a website at the state. It's not a great one that tests about that. So the only places that are open after 7 would be the urgent care centers to get tested. The hospital obviously is there, but that's not a place to go just to get tested. So Patty says, suggestions for what to do after the 2nd dose in case we have the same effects you did. Nothing. I mean, I went to work. I got it on Thursday. I went to work on Friday, just slept a little bit more on Friday. I mean, really, it was fatigue, but I had fatigue anyway just from working so hard. So, it was nothing big. My arm hurt. I certainly wasn't going to play volleyball or go boxing. But I don't think there's anything really special you need to do. I think the story is you probably wouldn't plan something really important the next day that you just had to get done, and maybe arrange to take the day off the next day. So many of the people who are doing this on a Saturday so that they can rest up on Sunday so they'll be good to work on Monday. So again, for example, many of the mass clinics are on Saturdays so that people have Sunday to recover. By 36 hours after my vaccine, I was at 100%. So Richard says, on the flash alert, it says qualifying veterans. What is a qualifying veteran? I don't know what that means. I know the VA does have vaccine. They do have a good amount of vaccine. And so it may mean that if you're qualified. So I just asked them, I do not know what that means. So Teresa says, if we go to extreme, do they close schools? It's complicated. So you have to look at the Ready School Safe Learner about what happens as the rate goes up. So as the rate goes up, schools have new things that they need to do, and they're supposed to be, and they're supposed to do new things along the way. So way too hard to explain here, but if you go to the Ready Schools Safe Learners, you'll see what happens. So Casey says, my wife and I have been very careful. I have a weird headache, low-grade fever, nausea, sinus issues, but no cough. Should we get tested? Yes. So the story is this disease ranges anywhere from a runny nose. I cannot tell you the number of people, oh, it's just a sinus. You know, my best story is like, oh, I thought there was something wrong with my mouthwash. I had this funny taste in my mouth and a sore throat. I thought there must be something wrong with my mouthwash. It was COVID. I cannot tell you the number of people said it was just allergies. You don't have a lot of allergies in January and February. The number of people said it was sinuses or whatever. So there's a lot of stuff. And again, most symptomatic people are not going to have COVID. Most people are going to have something funny. They are going to have tainted mouthwash. But the difference between COVID and a zillion other things is not that great. So yeah, if you think you have it, you should get tested. So Bobby asks a great question. Can it describe why a virus which originated in nature does not spread easily outdoors but does indoors seems backwards to the layperson? Yeah, it depends upon however, where in nature it was. So for example, if it was in bats are really remarkable. Bats, and we've talked about this in the past, but bats are one of the greatest vectors for disease. It's far more than mice and rats and all those things. Bats overwhelmingly carry disease. We think, for example, Ebola comes from fruit bats in Africa. And what happens is we think they poop and then people are in the poop. We think there's actually a tree in Africa that was hollowed out that kids like to play in. Well, the bats like to roost in it. And there was bat poop, and that's how one of the Ebola outbreaks started. So bats are responsible for Ebola. Bats in the U.S. are largely responsible for rabies. There's almost no rabies in cats and dogs, raccoons in the West. It's almost all in bats. And this disease, we think, came from bats in China. You say, well, bats are outdoors, they're flying around. But if you think of how bats roost, so they roost in huge groups indoors in caves. And the reason they do it in caves is there's very little airflow in the caves. And so they go inside the caves to roost. And that's where we think it would spread. Otherwise, the other place we would spread is in animals who are burrowing animals inside dens. So inside dens, it was a museum I went to one time that had sort of a cross section of a den, and I was like, dang, these animals are so close to each other, and that's how they would spread it there. So yeah, the question is, they don't live in rooms, so how would they spread this? But I think because bats live in caves. Now bats have a weird immune system that allows them to carry all kinds of diseases and not get sick from it. So they basically have told their immune system, chill, don't worry about this stuff. And so whereas other diseases would kill an animal from the inflammation, right? So we think a lot of the reasons you die from COVID is that your body has this really cytokine storm or this big immune response that seems to cause a lot of issues. If you could tell your body, hey, don't worry about a new germ, you would get this germ, your body would make some antibodies and you'd be done with it. So we think bats are most likely the place this came from. There was a group that went to China and that looked to see, was this a lab accident? They didn't think so. Was this related to frozen cod? They didn't think so. They think it likely came from nature, but I don't know. How much is a vaccine? I thought it was free, but I was charged $35. So the story is the vaccine itself is free, nothing is free, but the vaccine was all purchased by the U.S. government with the CARES money. It is then distributed to all the places free. However, they are requiring that anybody who gives it to charge an administration fee. In fact, one of the ways that it gets collected in the data is by charging the administration fee. In our country, believe it or not, that's how most things get recorded, because you charge a fee. So places need to charge a fee. Now, what's supposed to happen, though, is the fee is not ever supposed to be shown to the patient. It's supposed to go directly to the insurance company. The patient is not going to see it. So, Crystal, if you actually saw the charge of the $35, I'd love to see it, because whoever did that did it totally, totally wrong. So Dane says, if you were recently vaccinated but prescribed an antibiotic, will it affect the vaccine's effectiveness? We do not think so. So we do not think that the use of antibiotics will really affect the efficiency of the vaccine. There is some concern about some of these immune modulating agents, prednisone or methotrexate or some of these other meds, because there's been some suggestion that they could decrease the effectiveness of other vaccines. And I listened to a long and very boring talk yesterday about the different ones and how they different work. So it's possible that the immune modulating agents might change your response, but probably not an antibiotic. So Gretchen says, can we sign up in Roseburg to get our second dose if Reedsport doesn't have enough? So again, if you got your first dose in Reedsport, your second dose will follow that first dose 28 days later. It won't be in Roseburg. So we're really, really, really saying, if you got your first dose in Reedsport, you should get your second dose in Reedsport. If you got your first dose in Roseburg, you should get your second dose in Roseburg. Yeah, so Emily says, well, why are the other counties dropping cases and we've seen increased numbers? So you'll remember for 8 weeks now, I said, we're the only big county in Oregon that's open. And we were. We're the only county on I-5 that's open. And we were. And because we were open, we opened schools. Because we were open, then people said, well, things are getting better here. And sadly, a lot of people went to Super Bowl parties. They said it's open here and people are gathering before and after work. I live around the corner from a big bar. Oh my goodness. If you look at the number of cars that are parked outside there on a Friday night, it's enormous. The whole street is lined up with cars. And, it's not that big a place, so people really must be gathering in those places. In other counties, the bars have been closed. And so, yes, people may have been gathering at people's houses, but not nearly the kind of gathering that we're seeing at some of these bars and other gathering areas. Yeah, so Crystal says, I don't have insurance, so they sent the bill to me, so please don't pay it. You should not be getting the bill. And if you, Crystal, you could say where that was, because I'll tell them that they're not supposed to do that. Because what's supposed to happen if people don't have insurance is the feds are supposed to pick up that fee. However, they've never come up with a strategy to do that, so that may be the answer. But nobody's supposed to send you the bill. Now, they might send an explanation of benefits, right? So an explanation of benefits, this is what we charge and what the insurance pay. They're allowed to do that, but they're not supposed to actually send you a bill. So Crystal says, how long do you have immunity after having the virus? We don't know. What we do know is that people, right, we're now having people who've had the virus a year ago. We do know that for at least 6 months after having a natural infection, if you get exposed to the non-variant viruses, you have pretty good but not perfect protection. The concern is that in Brazil, there's this area in the Amazon, that a city of 2 million. So who knew there were cities of 2 million in the Amazon? But there's a city of 2 million in the Amazon, and they had a huge outbreak in the springtime. Almost everybody got infected, and they thought, well, it was bad, but we're not going to get it again, and they're all getting it again. So at least in that area, a year later, they have very poor protection. Now, we don't know if they have very poor protection because after you have poor protection, or because the variant is different enough that they won't have protection. That's something we don't know, but something we really need to find out. So Patrice says, my sister's had 2 kidney transplants. Oh my goodness. Should she get vaccinated? She should definitely talk to her transplant surgeon. So vaccines in people who've had transplants are problematic in a couple of ways. One is they're frequently on immune suppressing meds. And then there's some concern that vaccines stimulate your immune system, right? That's what it's doing. The sleepiness you get the next day, the sore arm, is because your immune system is getting really revved up because of the vaccine. And there's some concern among some transplant surgeons, and not all, and that's why you need to talk to your transplant person, that this revving it up will it have the untoward effect of revving up your own body's immune system to now attack your transplanted kidneys. That would be tragic. So your transplant surgeon knows far better than I do about Patrice's sister, so please, please, please. Bob and Karen say, I heard that you should get your second dose in the opposite arm for the first one. Is that true? We don't think, I've heard that too, to sort of spread it out so your body's making double the immune response. This was not studied in either Moderna or the Pfizer, and at least for any other vaccine, it doesn't seem to make a difference where you get it. And when you think about it, really shouldn't. I mean, what's happening the second time, and the reason you're building the immunity the second time, is your memory B cells and your T cell lymphocytes are around, and they're not localized. Right, so they're all around. Okay, fascinating thing that I saw, and this is just something that you should point out, about 5% of the people who got the vaccines got a swollen lymph node. This happens all the time. You get a scrape or a cut, and then you wind up with a lymph node along the way. So, for example, when I'm examining a 2-year-old, they almost always have a couple of little lymph nodes in their groin. In fact, it's rare to find a kid who doesn't. And what's it from? Well, they stub their toe, they buck their leg or whatever, and then they have a little lymph node in their groin area here. And they're typically tiny, about the size of a pea or whatever. The parents, oh my goodness, what's going on here? Well, they run around and they've got this, and it's almost never an issue in babies. Every part of your body has lymph nodes that's responsible for. So your legs, your lymph nodes responsible for it are in your groin. For your hands, it's the ones back here. So we'll see people get a cut on their hands and then get a node back here called the epitrochlear node. The glands underneath your arms and your armpits are responsible both for your arm and for your breast. And so there have apparently been a number of cases where people have gotten the shot, gotten a node underneath their arm, and thought, oh crap, that's breast cancer, because one of the symptoms of breast cancer is a node under your arms. And apparently that's been noted a couple of times there. People got the vaccine, got a node under their arms, and people said, well, I don't know what it's from. It could be cancer. And so if you do see a lump under your arm and have gotten a COVID shot, be sure you remind your doctor that, yeah, I did get a COVID shot in that arm, because it may avoid all kinds of other things. Because typically on those nodes, they grow up over 3 weeks and then go away over the next 3 to 6 weeks. Cancer nodes clearly don't do that. So that was an interesting thing I saw this week. So Pam says that if the county is extreme, can restaurants open outside dining or just take out? I do not know about outside dining. That certainly inside dining is more restricted. So Michelle says, if I'm fully vaccinated and I visit a person with recent COVID exposure with no symptoms and I wear full PPE, am I safe? No. So remember, there's nothing that's totally safe or totally dangerous. Clearly having the vaccine increases your safety tremendously. Wearing a PPE is increasing your safety. But again, somebody with recent COVID exposure could be brewing the disease, and you won't know this until they actually get the disease. So in that way, having the vaccine is safe and having the PPE is safer, but being exposed to somebody with a recent exposure is unsafe. So overall, I wouldn't do that. Now, I probably have to do that sometimes in the clinic, right, where we have somebody come in who's got a contact with COVID, but I know exactly how to use PPE. So Michelle says, I have had cancer and I have no lymph nodes in one arm. Should I get the vaccine in that arm? Well, So frequently what will happen is when they do breast cancer surgery, they'll remove the lymph nodes so you can do it. If you have two arms, I just get in the other arm. I mean, there's no reason not to get it. There's no reason just not to get in the other arm. And then you can avoid that. Yeah, so Penny says, I'm 3 weeks shy of 70. Congratulations. And I'm a caregiver for my husband who's eligible next week. Can I get it when he does, or do I have to wait? So different states have different ways. So in Massachusetts, if you drove somebody who was eligible to a vaccine, you could get one. And there were all kinds of craziness going on, people volunteering to drive so they could get their vaccine or whatever. In Oregon, that's not the case. You need to wait until you are independently eligible. So you'll be eligible in 2 weeks from yesterday. Now, eligible, and somebody excoriated me, says, don't say you're eligible. And because if there's no vaccine, how can you say I'm eligible? So eligible means you're eligible. You could get it. Doesn't mean you are going to get it. Again, getting the small number of doses we've had, and with our doses for this week, which was typically would arrive on Monday, we don't even know when they're going to arrive. We're way behind. We have 12,000 people to vaccinate, and we've gotten, for those 80 and above and those 75 and above, we have really gotten a total of 700 doses. And somebody's been writing stuff in the newspaper that I'm lying about the number of doses. I mean, I'll show anybody who wants to know the data. I mean, I don't make anything from lying here. That's really what we got. Now, we've clearly gotten more doses than the 700 doses. We've gotten those for the educators and the 1As and everybody else. But over the last few weeks, they have actually allocated the specific doses for those over 80, and this week for those over 75, and those were the numbers I quoted. So we clearly don't have enough, but as I said, I'm really hoping we can get more. We've done a couple of really good things here. We have 3 of those super cold freezers. So this week there's a little extra Pfizer vaccine that some places can't take. So we're going to suck that up. So we're going to do whatever we can do to get more. So Cheryl says, I live in Douglas County, but my primary care is in Cottage Grove. Nobody can tell me where to get the vaccine. So you can ask your primary care doctor in Cottage Grove. I do not know what the Lane County model is going to be yet. I mean, it's a little scary, but I don't know what their model is going to be. For people whose primary care is not in Douglas County, and I'd encourage people to have a primary care doctor where they live. But if you don't, you can get it at one of the participating pharmacies. The participating pharmacies as of this week are Costco, the 2 Albertsons, the 3 Bi-Marts, Fred Meyer's, and Gordon's Drug. And certainly we hope as we get more vaccine, we can get more and more vaccine to those pharmacies, because the pharmacies really want to do it. In addition, we're in talks with several other pharmacies to add, and I think we're going to have a really robust pharmacy network here in Douglas County. Okay, 2 other things I want to talk about. You know that for months now I have been really not in favor of what's called pre-event screening. Get a test before you fly, get a test before Thanksgiving to visit grandma, because statistically it doesn't work, and it's a lot of money, and it gives you false reassurance. So there's a group called Abundance 360. So this is a big group. You pay $12,000 to go to this conference. And so they were going to have a conference in Southern California where they invited 80 people and had 35 staff members there. And they said, we're going to test everybody before they come and do a PCR, and everybody's going to be negative, and things are going to be great. You don't have to wear a mask, and you can hug just like the old days. What did they find? Well, you know why I wouldn't be reporting on it unless there was a story here. And the story was that there was somebody who was asymptomatic when they got there, had a negative PCR test before they got there, developed symptoms. They exposed 35 people had disease out of the 80. 35 people out of the 80 got it. Now, interestingly, there were 35 staff members who wore masks. None of them got it. So the staff members who wore masks and stayed away and followed precautions didn't get it, but 35 of the 80 that thought they were protected because they had a test got it. Alaska, which was one of the earliest places to do testing, gotten rid of it. It has really not worked for them to prevent disease, and it's been a phenomenal hassle. The last thing I want to talk about was the NFL. Who believes? Early on, the very first weeks of this, I said that one of the groups to be congratulated was the NBA. They early on recognized that basketball games and all the people crowded in the arena was going to be an issue. And they were the first of the sports leagues to cancel their season. And when they did, many of the others did, and the lockdowns happened, and I think that really helped us avoid lots of bad disease. Well, who would guess that now some of the best studies on this have come from the National Football League. So the National Football League, a multi-trillion-dollar organization here, I don't know, multi-billion at least, dollar organization, desperately wanted to have a season this year. I mean, a season without NFL football would have been a tremendous economic loss to the teams and to the TV stations and to the players. And so they made an incredible effort to stop transmission of COVID in the NFL. And so they did a lot of things. They did a tremendous amount of testing. I think they did $120 million worth of testing. Now, $120 million is like 2 Tom Brady, so it's not that much, but they spent a tremendous amount of money on testing. They had these little proximity cards, and so what these proximity cards could test if somebody else was close to you. And so they knew who was around who. Again, they tested a lot of people a lot of times, and they were very strict. So if you watched I think it was the Denver Broncos in one year, they had this wide receiver who hadn't played quarterback in 5 years as the starting quarterback. It's like, what's going on here? What happened was there were a number of the quarterbacks that had a meeting and they was clandestine and they didn't wear their proximity things. And they said, look, you broke the rules, you're out for this week. And so they had to start this wide receiver and they got clobbered. But the story is they were very strict about it. They wore the proximity badges and they hired groups of people to help them study what went on. And what did they find? Well, it was an interesting study. Some teams did great. The Seahawks did great. They had almost no cases. Other teams just had a lax attitude. They had a lot more cases. What did they find? They found that riding in cars together, really a bad idea. So riding in cars with somebody was a way to spread the disease. Having a meal with somebody was a bad disease. Having a meeting with people in an unventilated room was a really bad idea. And breaking the rules, like going out to a bar in between games, was a really bad idea. That's all where it spread. But people who followed all the rules, that is, they didn't have team meetings in unventilated rooms, they wore masks, and whatever. There was almost no transmission. There was very, very, very little transmission. In fact, maybe no transmission outdoors. And so these guys, they're in each other's face and breathing on each other. Really not a lot of spread that way. Almost all the spread happened indoors, unventilated areas, especially during meals and especially during travel. And so what does that tell us about Douglas County? Well, when the sports team decides, hey, we've just had a big, tough practice, let's go, hey, why don't you guys get in my car and we'll go to McDonald's and have meal. I mean, that's exactly what you do on sports teams, but that's how it spreads then among the groups. So the NFL did just an amazing study that suggested outdoors much safer than indoors, that being together even for less than 15 minutes if you were close in an unventilated area was really a risk. Driving together, really a risk, and eating together, really a risk. So what should you do? Well, I mean, if you really want to be safe, other than my family, I sometimes go to a restaurant, but will eat by myself. I don't ever get in the car, try never get in the car with anybody other than my spouse. And I try really, really hard to stay away from people who are sick. And so these are all the things that you can do to go ahead and reduce your risk of disease. Okay, well, it looks like we are getting to the end of the questions and the end of the hour. So this is perfect timing. Again, we're going through a tough time here, but we will get through this. We really will get through this. I think we need to buckle down for not that long. Again, remember this disease has a relatively short incubation period. So this is not a disease like HIV that had an incubation period of weeks or months. And so it was really hard to know what happened. Or a disease that is really, really hard to stop. So Ebola, when it happens in an area, is so incredibly contact contagious that it's really hard to prevent spread. This one, you can prevent spread. So it's got a short incubation period. It's got a relatively easy to prevent spread. And we are right on the cusp of getting this vaccine out there, which we've shown is to be incredibly effective. I mean, among the workers, we don't have the final numbers, but it looks like it's 100% effective among fully vaccinated workers. I mean, you can't ask for much better than that. And so, we can do this. So if we just take it easy for a few weeks, really double up on the efforts here, we'll be able to get this rate down and go back to some reasonable semblance of life. Okay, again, and also people have been incredibly kind. I did a long walk on Sunday and I saw these people, oh, Dr. Bob, thank you. And it really is a huge team that's doing this. So I'm sort of the public face here. But even doing this tonight, we have 2 people working full-time to make this work. We have 35 people who work for Douglas Public Health Network now doing this. And they do stuff like they answer the phones, they drive stuff all around, they're delivering meals to people's houses. They're doing all of those kinds of things to keep this disease in check. And so while I may be the public face, boy, there's a lot of people working on this and working very hard. And in general, we've been incredibly pleased. People have been incredibly kind and incredibly grateful. I know there are people who disagree. And if you disagree, I'm perfectly willing to go ahead and show you the data, right? So if people say I'm lying about this or that, please don't say that. I mean, I don't lie as best I try. But the story is, if you want to know the data, say, could you show me the allocations for last week? And I'll be happy to show you the allocations. There's no secrets here. We'll be happy to show you that. Now, there are secrets in terms of people's protected information, but otherwise, there's no other secrets here, and we'll share with you. And for the most part, people have been incredibly kind. So thank you. Be safe and be kind. And we'll do this again on Friday at 4 o'clock. Thank you.